I'm starting this. Okay, I'm starting our session. Let's start. Okay. All right. So in reading part B, you will be going through 6 different extracts and you will be answering 6 different questions. Okay. So 6 different extracts and 6 different questions. And the important aspect that you need to remember is for reading part B, together they will, for part B and C together, you will have one timer of 45 minutes, which means out of this 45 minutes, you should be spending minimum 30, maximum 15 minutes for part B, not more than that. Okay, and don't be, don't get too much distracted by part B. As soon as your time reaches 33 minutes, your timer reaches 33 minutes, make sure to move on to part C. Okay, all right. So coming to part B, as I told you, you get 6 questions, 6 different extracts and 6 questions, and your questions are multiple choice questions. So you need to choose the most appropriate option out of the 3 options given. Okay, so how do you approach reading part B? You start with your question. So there are different ways you can approach, whichever that you feel comfortable. Okay, you can start with your question, then interpret your question, then read your text, then look at the option. So that is the first method, which is, that's what I would recommend. I would strongly recommend. Read your question, interpret it, and then read your extract. Okay, then go to your options and choose the most appropriate options out of the 3 options given. So that is the first method. Okay, all right. Now, other than that, you can also one second. Let me arrange your screen so it's clearly visible to all of you. Yes, so that is one method: question, text, options. Or if you're comfortable, you can read your text first, then read your questions, then look at your options. Read your text, then read your question, understand it, then from the option choose the most appropriate ones. So these are this is the first method that I told you, and this is the second method that I've just told you. Okay, so both will work. It's according to you, which you feel comfortable, which helps you to navigate through your part B quickly. You can opt that. Okay, the first one is also fine, the second one is also fine. Okay, now other than that, there is a third method, that is this one, where students, I've seen them starting with the question, options, then finally looking at the text. Personally, I would not recommend it. I would not recommend this method because if you read your options before your text, then you read your options, then you read your text, then you come back to your options. You're not only a lot of time you're spending there. More than that, your elimination process will become very difficult. Okay, you read the options, then you read the text, then again coming back to the options, you will be a bit confused. So either go with the first order or the second order, whichever that you feel comfortable with. I'm not saying third one is completely wrong. I'm saying third one can be quite confusing, and it can take a lot of time consuming as well. And elimination process will become really difficult. So go with either the first one or the second one. Okay, so on that note, let's dive into today's material. I need your attention. Today's materials are really good. Here we go. Okay, let me admit a few people. Okay, let's start with the first one. Nandini, can you unmute yourself and read the first question for me, please?
Yes, ma'am. This section of the guidelines establishes.
So all of you go through the question. This section of the guidelines. So what type of extract are we reading? We are going to read guidelines. So this section of the guidelines establishes. I want all of you go through the question. Tell me here in this question, what does the word establish mean? What is the meaning of establishes? Tell me. Yes, tell me. Come on. Nandini, Gino, Princey, what do you guys think is the meaning of the word establishes here? When I say, yeah, tell me, Nandini.
Elaborate.
Very good. Not elaborate, says or conveys, okay, or explains, okay. Which again brings me to an important thing. Make sure after today's session, if you get some time, go to Cambridge Dictionary, Google it, Cambridge Dictionary, and go to and type the meaning of the word establish and find as many meanings as you can about the verb establish. There are many meanings. Certain places it means find out, certain places it means implement, certain places it means introduces, certain places it means conveys, explains, or says. Okay, so make sure to find out as many meanings as you can for the verb establish. So here it means conveys or explains. So basically, we need to figure out what does the guidelines. What do the guidelines? I'm sorry. What do the guidelines say or convey? Say. Do came, so say. What do the guidelines say? Okay, say. All of you go through it. So remember to figure out, find out as many meanings as you can about the verb establish. Okay, all right. So we know we are going to read a guidelines. We know a section of the guidelines, and we know we need to find out what do the guidelines say. Get ready. Let's take 55 seconds. All of you go through your extract. Come on, all of you. All of you go through it. Okay, Nandini, can you read the heading and the first paragraph for me, please?
Yes, ma'am. Guidelines for phlebotomist. Discrepancies in the identification of patients are dangerous and may result in loss of life as well as in costly and frustrating errors such as delay in diagnosis, appropriate laboratory testing, and subsequent treatment. The phlebotomist is only the person in a position to detect any discrepancy between the identity of the patient and the medical order. Whenever possible, the patient should participate in the process of identification, and this should happen prior to any blood collection.
Okay, let's understand. So these guidelines are for phlebotomists, and the first sentence says that discrepancies means problems or things that are not matching up. Okay, discrepancies. Okay, problems or gaps in the identification of patients. Problems in the identifications of patients are dangerous. Okay, are extremely serious thing. It can be dangerous, and if there are problems with identifying patients, in the identifications of patients, if there are any problems, those problems are dangerous and may result in, that can lead to loss of life, death of a person, as well as in costly and frustrating errors, expensive and frustrating errors, such as, what are those errors? Delay in diagnosis, inappropriate laboratory testing, problems with lab testing, and subsequent treatment. So if there are any problems with identifying the patients correctly, it can be dangerous and can result in loss of life. It can lead to frustrating errors such as delay in diagnosis. It can affect the appropriateness of lab testing. It can also affect the following treatment. Okay, the phlebotomist is the only person who is in a position where they who are the only ones who can identify any discrepancy between the identity of the patient and the medical order. So phlebotomist is the only person who can identify any problem between the identity of the patient, of who the patient is, and their medical order. Okay, so discrepancies of identifying the patients can cause a lot of problems, and phlebotomist is the person who can identify any discrepancy between the identity of the patient and the medical order. Wherever possible, in whatever scenarios possible, the patient should participate in the process of identification. So in whatever situations possible, the patient should participate in the process of identifying themselves, and this should happen before collecting blood. All of you go through it, come on. So discrepancy in identifying patients can be problematic. It can cost people their life. It can also lead to costly and frustrating errors such as delay in diagnosis, affecting laboratory testing and the treatment. Phlebotomist is the only person who is in a position to detect this discrepancy, this variation between the identity of the patient and the medical order. And wherever possible, the patient should participate in the process of identifying themselves, and that should happen prior to any blood collection. Okay. Nandini, can you read the last paragraph? I need your full attention. Here we go, Nandini. Please start.
Yes, ma'am. Best practice requires that the procedure begins with the identification of the patient, after which the container is labeled. A sample is then taken and placed in the labeled container. Samples should never be placed in unlabeled containers, and containers should never be labeled in advance of patients being identified. In particular, several containers should never be labeled before a group of patients arrives.
Yeah, they are talking about what would be the best practice methods. Okay, so they say that best practice needs that the procedure begins with the identification of the patient. So the best way to carry out anything would be start the procedure by identifying the patient. After that, the container, then label the container. A sample is then taken and placed in the labeled container. So you identify the patient, then you label the container, then you take a sample, then place it inside the labeled container. Samples should never be placed in unlabeled containers, and containers should never be labeled in advance of patients being identified. So you should never place your sample in a container that does not have a label, and you should never label the containers without identifying the patients in advance. And especially, several containers should never be labeled before a group of patients arrive. So you have a lot of patients coming in. So before they come, before they arrive, you cannot label many containers at the same time. Okay, all of you go through it. Come on, all of you. So it talks about discrepancies in identifying patients can be problematic. It can cause a variety of problems. Phlebotomist is the person who is responsible to identify this, discrepancy in identity and the medical order. Wherever possible, patients should participate in identifying themselves, and this should happen before the blood is collected. And best practice measure means before the procedure begins, the patient needs to be identified. After identifying the patient, then the container is labeled. Then the sample is collected and placed in the labeled container. You should never place a sample in an unlabeled container, and you should never label the container without identifying the patient. Especially if you have many patients coming in, a group of patients arriving, you should never label it beforehand. Are you guys clear? All of you go through it. I want all of you to be clear with the extract. Nandini, Reshma, Preeta, Jinu, BP, others, are you clear? Sneha, Raji, Princey, are you clear?
Yes, ma'am. Clear.
Okay, so let's have a look at our options. Okay, as you can see, this is an incomplete question. This question does not end in a question mark. When you have a question that does not end in a question mark, make sure to read each option with the question. Okay, please go ahead and read it. Okay, Nandini, you can read it. Yeah.
Yes, ma'am. Can I read, ma'am?
Yeah, sure. Go ahead.
This section of guidelines establishes how to reduce the risk of samples being mislabeled.
Do the guideline establish, tell us how to reduce, how can we reduce the risk of mislabeling the sample? What do you guys think?
Can be, ma'am.
It can be, right? It can be. Okay, next one.
This section of guidelines establishes what to do if a patient is unable to confirm their identity.
Have they said what we need to do if the patient is unable to confirm their identity?
No, ma'am.
No, it's not said, so we can reject that. Next one, Nandini.
This section of the guidelines establishes the procedure to follow if any discrepancies are detected.
If you detect any discrepancies, any problems, what procedure to follow? Is that have they said that? What procedure to follow? No. So what is the answer? Answer is A. The entire paragraph, right? The second paragraph, right? It tells us how to reduce the risk of mislabeling the sample. How can we reduce? Before the procedure begins, identify the patient. Only then label the container. Then put the sample inside the labeled container. You should never place the sample in unlabeled containers, and containers should be labeled only after the patient is identified. So all those things tell us how to reduce the risk of samples being mislabeled. All of you go through this question, the options together. I'll zoom out so you can see the whole thing together. Please tell me if you need any clarifications, and remember the meaning of discrepancies. Okay, all of you go through it. Come on. This is very much OET oriented material. You need to know the meaning. You need to understand it very well. Okay, all right. So I'm moving on to the second question. Okay, Sneha, would you mind unmuting yourself and reading the question? Let me just zoom in so the question is visible on your screen clearly. Okay, can you read the question, Sneha? Yeah.
Yes, ma'am. The memo remains staff that parents of patients in neonatal ICU.
We know we are going to read a memo. We know our extract is a memo. What do we need to find out? All of you pause and read and connect the meaning and tell me.
What the memo remains.
Yes, correct. What does the memo? What does the memo? Memo remind.
Staff.
Who remind? Staff. Staff. After that, staff.
Parents
Staff about. Interpret that as about. Staff about Parents of the
Parents of
Patient.
patients in
neonatal ICU.
yes, very good, in neonatal ICU. All of you go through the question, okay? So don't be like we need to figure out what does it remind parents and staff. No, see that remind staff about. This means about. Okay, you have a subject after that. If they place that, it usually means about. Okay, so the memo reminds the staff about. What does the memo reminds the staff about? Parents of the patients in neonatal ICU. All of you go through the question. The memo reminds staff that interpret it as about this topic. So what does the memo remind staff about this particular topic? Okay, clear? All right. So let's read the extract. Okay, all of you take 55 seconds, go through the extract. Let me just zoom in. Yeah, go through the extract. Come on. Make sure to read the heading. Do not miss out on your heading. Okay, Sneha, if it's okay with you, can you read all the headings and till here, please?
Okay, ma'am. Memo to all nursing staff in neonatal ICU. Please ensure that parents are fully aware of the revised rules regarding visiting hours. Neonatal ICU visitors, parents can remain in the unit 24 hours a day, but may be asked to leave during ward rounds and procedures. It is, however, recommended that mothers rest at night to avoid exhaustion. Grandparent visits are allowed up to 2 hours per day, 1 hour in the morning and 1 hour in the afternoon.
So this memo is to all the nursing staff in the neonatal ICU. And the heading is please ensure that. So they are requesting the staff to ensure that parents are fully aware. Parents have correct knowledge of the revised. So they have changed the rules regarding visiting hours. So they need to ensure that the staff need to ensure that the parents are fully aware of the changes, revision in the rules regarding visiting hours. So so they have said that neonatal ICU visitors, parents can remain in the unit 24 hours a day. So parents are allowed to stay in the unit throughout the day, the whole day. However, they may be asked to leave during ward rounds and procedures. So when the doctors are doing rounds, or when they're carrying out a procedure, they might be asked to leave their kids, because otherwise they can stay in the unit 24 hours a day. It is, however, another thing is that they also recommend that mothers rest at night to avoid exhaustion. Okay, so parents can stay all the time. However, they might need to leave the place. Leave the ward during rounds and procedures. And mothers are recommended to rest at night in order to avoid exhaustion. Grandparents, okay, the grandparents are allowed to visit up to 2 hours a day, maximum 2 hours a day. That is 1 hour in the morning and 1 hour in the afternoon. Sneha, can you now read till the end for me?
Ma'am, but there should be no more than 3 visitors at any one time. It is up to each unit to decide whether siblings might visit, but where this is allowed, a member of staff should monitor them at all times. No
Okay.
other children may visit. Our patient safety is our utmost concern, and if a parent is not present and has not given permission for visitors, we can and will refuse entry to the ward.
So now they are like, but however, so they talked about parents can there in the ward all the time, but they might be asked to leave when they're doing rounds or carrying out the procedure. Then they told that mothers are asked to rest at night in order to avoid exhaustion, and grandparents can visit a maximum 1 hour a day, 1 hour in the morning, 1 hour in the afternoon. However, there should be no more than 3 visitors at any one time. So during the visiting hour, at one time only maximum number of three visitors are only allowed. It is up to each unit. It is up to the unit to decide whether siblings might visit. Can siblings visit the baby? That decision is up to each unit. However, where this is allowed, where the siblings visits are allowed, a member of staff should monitor them at all times. So allowing siblings is up to the unit, and in whichever unit it's allowed, the members of staff should be there to monitor them at all times. No other children are allowed to visit. Okay, our patient safety is our utmost concern. Our patient safety is the most important thing. And if a parent isn't present and hasn't given permission for visitors, if there is no parent and if the parent has not given permission, then the staff can and will refuse entry to the ward. So they've talked about how parents can be present 24 hours a day. They may ask to leave when rounds or procedures are happening, but mothers are recommended to rest at night in order to avoid exhaustion. Grandparents are allowed to visit maximum up to 2 hours a day, 1 hour in the morning, 1 hour in the evening. But at one time there should be no more than 3 visitors. And siblings visit is decided by the unit. However, if that is allowed, a member of staff should always be there to monitor them, and no other children are allowed to visit. And patient safety is their utmost concern. If parents are not present or has not given permission for visitors, then they can and they will refuse entry to the ward. Nandini, Raji, Sneha, Jinu, Betty, Bibi, Preeta, Reshma, Jelmi, others, tell me, are you clear?
Yes, ma'am.
Okay, let's have a look at the options. As you can see, again, another incomplete question. So can you read each question with each option with the question for me, please?
Yes, ma'am. The memo reminds staff that parents of patients in neonatal ICU may bring their other children to visit if they wish.
So other children visiting, is it up to the parents? Does the memo say that parents of the patients in neonatal ICU are allowed to bring their other children to visit if they wish?
No.
No, ma'am.
No. That decision is made by the unit, not by the parents. Okay. All right. Next one.
The memo reminds staff that parents of patients in neonatal ICU can choose whether they want other adult visitors.
Have they said that if the parents are allowed to choose whether they want the presence of other adult visitors or not? What do you guys think?
Can be, ma'am.
Can be. Okay, I'll take that. Okay, let's have a look at the last option. Sneha, can you read the last one?
Yes, ma'am. The memo reminds staff that parents of patients in neonatal ICU need to accompany other family members who visit.
Did they say that the parents need to accompany other family members?
No, ma'am.
No. So what is the answer?
B.
Why B is the answer? Look at the last sentence. So the option is parents can choose whether they want other adult visitors. So they have said that our patient safety is our utmost concern. If a parent is not present and has not given permission, then we will refuse entry to the ward. So that means parents need to give permission for other adult visitors. Are you guys clear? And children visiting the ward, that is up to the unit. It's up to each unit to decide whether siblings might visit. But parents can choose. They can give if they don't have if the staff do not have the permission from the parents, they won't allow. They can and they will not restrict. They will refuse entry. So that's why the parents have the right to give permission. So that's why B is the answer. All of you take a second, go through the whole thing once again and ask me if you have any question. Make sure that this is clear to all of you. Clear? Is that clear?
Yes, ma'am.
Okay. All right. Okay. Now let's move on to the third question. Betty, would you mind reading the third question? Let me just zoom in, Betty, so it's visible on your screen with clarity. Yes, Betty, you can read the third question.
Okay, ma'am. The policy document says that a risk assessment should be carried out.
Okay. The policy document says that. So we are going to read a policy document which says that, which talks about a risk assessment should be carried out. So here, as you can see, they have given a action or a situation, right?
Yes, ma'am.
Okay, one second, let me write it down. Situation. So that means we are looking for what are we looking for? It should be carried out when, yeah, or under what circumstance. Okay, so we are looking, so they have given a situation, so we are looking at the complementary situation, under what situation, under what circumstance. Okay, that's what we are looking for. So one second, let me see. Yeah, so when they have given, so should be carried out, if they use if, when, unless, should be carried out, all those things, using all those things, if they've given a situation, and that's where your incomplete question ends. That means we are looking for the complementary situation, the matching situation. So we're looking at when and a risk assessment should be carried out. Sorry, a risk assessment should be carried out.
Under what?
Yes, when or under what circumstance. So always remember when they've given a situation using should be plus V3 or if or with unless in case, then we are looking for the matching situation. Okay, all of you go through this. Come on, action or situation. That's where your question ends. That means we are looking for the complementary action or the complementary situation. That's why I use when or under what circumstance. Are you guys clear? Okay, perfect.
ma'am.
Yes, ma'am.
All of you go through the extract. Take 55 seconds. Let me just zoom in so it's visible. The focus is on the extract. So all of you go through it. Come. This is our third question. Go through it. Yes. Okay, Betty, can you read the heading and the first paragraph for me, please? Yes.
Okay, ma'am. Risk assessment. Members of staff working with substances that have the potential to cause harm should contact occupational health for advice if they are planning to have a child. On becoming pregnant, such staff members should inform their line manager in writing as soon as possible after receiving confirmation. Similarly, new mothers should inform their line manager by email in advance of returning to work in these areas if they are still breastfeeding.
Risk assessment. So the extract is all about assessing the risk. Members of staff, first sentence says that members of staff with substances that have the potential to cause harm. So if you have staff members who work with substances, who work with harmful substances, they should contact occupational health for advice if they're planning to have a child. So if the staff members are planning to conceive, then they need to contact the occupational health if they belong to if they are the ones who deal with or who work with substances that can cause possible harm. And once the staff are pregnant, such members should inform their line manager in writing. They need to inform their manager by writing everything as soon as possible after they receive the confirmation of their pregnancy. So once their pregnancy is concerned, so when they're trying, they need to, when they're planning or trying to have a child, or when they're deciding, when they're making the decision to have the child, they need to inform the occupational health for advice. And if they become pregnant and the pregnancy is confirmed, they need to inform their line manager in writing. Okay, so in the same way, new mothers should inform their line manager by email in advance of returning to work in these areas if they're still breastfeeding. So if the staff are new mothers and they're still breastfeeding, they need to inform that they're coming back to work in advance through an email. Okay, all of you clear? Okay, last paragraph, Betty, second paragraph.
Upon notification that an employee is pregnant or breastfeeding, the line manager should carry out a risk assessment. This considers all categories of activity undertaken by the employee, will supplement any existing assessments for the work, and may also cover some areas not previously considered. This information is needed so that decisions related to the management of risk can be made in an informed manner, and that any action taken is proportionate to the risk.
Okay, upon notification, so upon notification, upon receiving information that an employee is pregnant or breastfeeding, then the staff member will confirm. Once the confirmation comes, the staff member will give a in the written form. They will inform to the line manager about the confirmation of the pregnancy. And if the new mothers who are breastfeeding still are coming back to work, they will send an email in advance. Okay. So upon receiving such notification that an employee is breastfeeding or pregnant, the line manager should conduct a risk assessment. This considers all categories. So when they carry out the risk assessment, it should take into consideration all category, all types of activity undertaken by the employee, and the risk assessment will supplement any assessments for the work. It will be added to the any other assessments that's carried for their job, and it also may cover some area that was not previously taken into consideration. So once the confirmation is received by the line manager about that staff member is pregnant or is breastfeeding, then the line manager should carry out a risk assessment, and the risk assessment must take into consideration all categories of activities undertaken by the employee, and that assessment will also will add on to any other assessment that they conduct at work, and it will also cover some other areas that was not previously taken into consideration. And this information, the information that they get after risk assessment, is needed so they can make decisions related to the management of risk in an informed manner with enough knowledge. When you're informed about something, when you do something with informed manner, you have the knowledge. So once they carry out the risk assessment, the information that they get from it, they can use it to make decision about the management of risks with all the knowledge, and any action taken is proportional to the risk. So they can also ensure that whatever action that they take matches the risk. All of you go through it. Come on. All of you. And ask me if you have any questions. Come on. So it talks about how if the staff who are working with harmful substances, they should contact occupational health for advice if they're planning for a child. And once they become pregnant and the pregnancy is confirmed, they need to, in a written form, they need to inform the line manager. And similarly, new mothers who are breastfeeding can inform the manager through an email that they're returning to work in advance. Once they receive this notification from an employee, the line manager should carry out a risk assessment. The risk assessment will take into consideration all categories of the patient's work, and it will also it will also supplement. It will also act as an extra piece of information when it comes to other assessments for the work, and it may also cover other areas that has not been taken into consideration before. And the information that they get from it is used to take decisions related to the management of risk. So they have enough knowledge on that, and it can also be used to take any action that is proportionate to that matches the risk. Are you guys clear? Any question?
Clear,
Betty, Jinu, Nandini, Sneha, others, are you clear? Okay, perfect.
Yes,
Okay, so as you can see, Betty, this is an incomplete question. Can you read each option with the question for me, please?
Okay, ma'am. The policy document says that a risk assessment should be carried out if a member of staff is intending to start a family.
So is that what they said, that if you need to carry out the risk assessment should be carried out if a staff member is planning to start a family? Is that when we should carry out the risk assessment?
No,
No, not when intent. When they are intending to start a family, they need to inform the occupational health. That's not when the risk assessment is carried out. So that's not it. Next one, Betty.
The policy document says that a risk assessment should be carried out before any member of staff on maternity leave returns to work.
Should they carry out the risk assessment before the staff returns to work?
no, ma'am.
The risk assessment?
No, ma'am.
No, that's not it. So of course our answer is option C. Can you read option C for me, please, Betty, with the question?
The policy document says that a risk assessment should be carried out once written confirmation is received from the member of staff concerned.
Right? Once the staff member gives a written confirmation, then a risk assessment will be carried out, right? Upon notification from an employee that the employee is pregnant or breastfeeding, the line manager should carry out a risk assessment. So if the member is pregnant, they will write it down, right? They will write the confirmation. Or in the same way, others will send an email. But once they receive the information, either through writing or either through an email, they will carry out the risk assessment. So that's why C is the answer. All of you, I'll show the whole thing on your screens. Please go through the question options and everything. Come on. Do not do a matching of the words in the options. You need to understand the meaning, compare it to what you have done. Okay, all right. Now let's have a look at the fourth question for today. All right, okay, 1 second. Okay, Bibi, would you mind unmuting yourself and reading the fourth question? Yeah.
Yes, ma'am. What is the purpose of this text?
So we need to figure out what?
Purpose
Purpose of
The
this
purpose of the
text.
text,
Purpose of this text. Purpose of the text. That's what we need to figure out. Okay. Right. So 1 second. Let me just arrange the screen. Give me a sec. Right. Okay. All of you go through the extract. All of you go through the extract. I'll zoom in. Oops. 1 second. 1 second. 1 second. Yeah. Right. Go through it. Okay, Bibi, can you read the heading and I'll tell you where. Till here. Yes.
Yes, ma'am. Colostomy patients diet. Patients with the stoma should consume regular balanced diet that provide carbohydrates, protein, fat, oil, vitamins, and minerals to maintain a healthy body. But screening of the nutritional status of patients with a stoma is necessary, as there is always a risk of malnutrition. For example, during the first day after an intervention, it is advisable to rest the intestine by the serving food in a more liquid form, and
Continue.
to prevent diarrhea and stomach cramps, small portions are recommended.
Okay, so this is about colostomy patients and their diet. So patients with stomas should consume regular balanced diet that provide carbohydrates, proteins, fats, oils, vitamins, and minerals to maintain a healthy body. So for patients who have stoma, they need to follow a balanced diet which include carbohydrate, proteins, minerals, vitamins, and everything that will ensure that they have a healthy body. However, screening of the nutritional status of patients with a stoma is necessary, as there is always a risk of malnutrition. So patients should follow a balanced diet. However, we need to carry out screening to check the nutritional status of patients, because there is a risk of malnutrition. For example, in the first days after an intervention, it is advisable, it is good to rest the intestine by serving food in a more liquid form. So in the first days after the procedure or after the treatment, patients are advised to rest their intestine by taking food in a liquid form. And to prevent diarrhea and stomach cramps, small portions are recommended. So considering all that thing, there is always a risk of malnutrition. So it's important to screen their nutritional status. Now, from here till the end, Vicky.
Okay. Also, some patients may not tolerate certain foods after the procedure, for example, dairy products, and this should be recorded in their notes. Whilst on the ward, patient will gradually move on to more solid food, but should be encouraged to chew these properly to avoid a blockage at the stomach side. Because of the food that may block the stomach include popcorn, raisins, and raw seeds. Friends and family visiting the patient should be made aware of this.
Okay. Also, some patients may not tolerate. So they talked about, how there is a risk of malnutrition and we need to carry out the screening of the nutritional status. And they are like, and they gave an example when after the first days after the procedure, patients will be taking food in liquid form to prevent, to rest the intestine, and in order to prevent diarrhea, stomach cramps, they will be given small portions. Also, some patients may not be able to tolerate certain foods after the procedure, such as dairy products, and that we need to note that down in their notes. Record that in their notes or document that in their notes. While the patients are in the ward, patients will gradually move on to more solid foods. However, they should be encouraged to chew these properly to avoid blockage at the stomach side. Examples of foods that may block the stomach can be popcorn, raisins, and raw seeds. Then friends and family who are visiting the patient should also be made aware of this. Aware of what? That they need to chew their foods properly to avoid blockage of the stomach. And these are the foods that can block the stomach. All of you go through it. Come on. Pretty straightforward. Any questions?
No, ma'am.
Okay. All right, so let's have a look at the options. As you can see, Bibi, this question ends in a question mark, so you don't need to read the question, just read the options one by one.
Option A, to reassure the patient who have recently had surgery.
Do you think this entire extra text was to reassure the patients who recently had the surgery?
No.
No, it was not for the patients, right? No. Next one.
Option B, to provide guidance for a patient carers after discharge.
This, whatever we read right now, was to provide guidance for the carers of the patient after the patient goes home. No, they talked about while in hospital, right? Not after discharge. So that's not it. So automatically our answer is naturally it's C. But can you read option C for me, please?
To help nursing staff monitor the effects of diet on recovery.
Right, while the patient is recovering, this extract is to help nursing staff monitor the effects of that. They said the patient need balanced diet, but we need to screen to ensure nutritional status, because first few days they will be taking liquid forms, or they will be taking small portions, and some foods might not agree with them, such as dairy products, and that should be noted down. Who should note down? The staff members, okay, not the carers. Then while the patients are in the ward, they will gradually start moving on to solid foods, and but we need to encourage them not to chew these properly in order to avoid blockage. And they've given the examples, and they've said that we need to make the friends and family aware of this. So that's why this extract is for the nurse or the health professional who will be taking care of the patient's diet while the patient is in hospital. So that's why C is the best option. Are you guys with me so far? Just okay, take a second before you confirm. Just go through the question, go through the option, go through the extract together. Come on, all of you. We just have 2 more questions to go. Clear? Was this clear? Okay.
Yes.
Let's move on to the 5th question. 5th question. Let me just zoom in. Give me a sec. Right. Okay. All right. 1 second. Right. Raji, would you mind unmuting yourself and reading the question?
Yes, ma'am. According to the update, one positive outcome of the ports policy could be.
Okay, so according to the update, so as per the, so that means we are going to read an update. We are going to read an update. One positive outcome of the PODS policy could be. So what are we looking for? What are we looking for?
What could be the one positive outcome?
One positive outcome of the one positive outcome. So could be means it's a possibility, right? So one possible positive outcome. Okay, always pay close attention to the meaning of could be, maybe, and or positive outcome of the PODS policy. Okay, of PODS policy. Okay, all right. All of you take 55 seconds. Go through the extract. Come on. I'll zoom in if it's to make. Yeah. Oops, 1 second, 1 second. Yeah. All 1 second. Yeah, correct. Go through it. Go through it. Okay, all right. So can you read till here for me, please, with the heading, till here.
Okay, ma'am. Update patients on drugs PODS policy. As part of its ongoing commitment to improved healthcare, the hospital is now encouraging patients to administer their own drugs wherever this is safe and practicable. The reason for this are it increases patients' knowledge and understanding of their medicines. It also encourages patients to take more responsibility for their health.
Okay, so update. This is an update about patients on drugs policy, PODS policy. As part of its ongoing commitment, their commitment to provide improved healthcare, as a part of their commitment to provide improved healthcare, the hospital is encouraging patients to administer their own medications wherever it is safe and practical. And they've given the reason. First reason is it increases patients' knowledge and understanding of their medicines. It means when they administer their own medications, it refers to administering their own drugs, increases patients' knowledge and understanding about awareness about their medicines, and it encourages patients to take responsibility for their health, be responsible for their own health. Okay, all right. Now the next 2 paragraphs. Go ahead, please. Yeah.
Patients often have their own routine for taking their medicines. PODs help them to stay as near to this routine as possible and allow for re-education if it is incorrect. Many medicines have to be taken at specific times related to food to maximize their benefits or to decrease side effects. Example, flucloxacin is better absorbed if taken on an empty stomach, whilst diclofenac is best taken with food to avoid gastric irritation.
Okay.
Traditional drug rounds cannot always accommodate these needs, but self-medication and the use of PODs can.
Okay, so they talked about one reason for making patients use, administer their own drugs is to make them give them the knowledge about and understanding of their medicine and encourage them to be responsible for their health. The next reason is patients have their own routine for taking their medications. So PODs help them to stay as near to this routine. So patients have their own routine, and the PODs system helps them to stick to that routine as much as possible and allows re-education if the routine that they are following is incorrect. So if whatever they have a routine, and the system helps them to stick to that routine as much as possible, and it also helps them to re-educate themselves if the routine is incorrect. Okay, then many medicines have to be taken at specific times according to the food, according to the meals or food, because that will maximize their benefits or decrease the side effects. For example, flucloxacin is better absorbed if it's taken on an empty stomach, while diclofenac is best taken with food to avoid gastric irritation. Okay, so they have given some medicines has to be taken according to the meals, because some medications their benefits maximizes when taken when it comes to the food thing, and sometimes it can decrease the side effects. They have given flucloxacin which is better absorbed on an empty stomach, while diclofenac is best taken with food to avoid gastric irritation. Then they are saying traditional drug rounds. So traditionally carrying out drug rounds cannot always cannot always take care of these needs, the needs that they've said right now, needs related to food, but self-medication and the use of PODs can. So traditional drug rounds cannot help with these needs. What needs are we talking about? So time related to medicines, time in relation to food. Certain medications should be taken on an empty stomach. Certain medication should be taken with food to avoid problems. So considering that, traditional drug rounds won't help us with that. So what will help us with that? This PODs system can help us with that. So all of you take a second, go through it and tell me, are you guys clear with the extract? Do you guys have any questions for me? Come on. Are you clear?
Clear,
Clear.
ma'am.
Okay, so now let's have a look at the options. As you can see, this is an incomplete question. So can you read each option with the question for me?
Okay, ma'am. According to the update, one positive outcome of the PODs policy could be to improve the effectiveness of certain type of medication.
Okay, is that the positive outcome, that it could improve the effectiveness of certain types of medications? Is that the positive aspect? Is that the possible positive aspect, that PODs policy can help to improve the effectiveness of certain types of medications? What do you guys think?
Maybe.
Maybe, can be, right? Can be. Okay, before, let's read the other options. Go ahead, Raji, can you read the other options?
According to the update, one positive outcome of the PODs policy could be to reduce the amount of staff time devoted to drug rounds.
Okay, so is it about is that the positive outcome, that the PODs policy can help to reduce the amount of time staff spent on drug rounds? Have they talked about the staff's time spent by staff? No.
No.
They have talked about drug rounds, but not the time spent by staff. So that's not it. Last option.
According to the update, one positive outcome of the PODs policy could be to make it easier to observe adverse reactions in patients.
Did they say that PODs policy? Make sure to mute yourself if there is too much of background noise. Okay, so yeah, thank you. So yeah, here, according to the update, one positive outcome of the PODs policy could be to make it easier to observe negative reaction in patients. Have they talked about observing adverse reactions?
No.
No. So of course, answer is option A.
Yes.
Why? See, at the end, the last point, see, many medications need to be taken at specific times in relation to food, because based on that, it can maximize their benefits. For example, this medication is better absorbed on an empty stomach. The other one is best taken with food. So that means effectiveness of these medications are dependent on the time you take your meals. So traditional drug rounds won't help with that, but self-medication and PODs can help with it. So that means in order to maximize the benefits of of the medications according to the intake of food. For that, to manage that, PODS system is better than traditional drug rounds. Considering that, option A is the answer. According to the update, one positive outcome of the PODS policy could be the improvement in the effectiveness of certain types of medication. What are those certain types of medication? The medication that has connection to food. Okay, all of you go through it. Come on, I'll zoom out. So go through the whole thing together. Yes, go through it. Come on. Go through it. Come on. Got it? Are you guys clear? Is this clear?
Yes, ma'am.
Clear, ma'am.
Yes, ma'am.
Perfect. Last question for today. Okay, let me just zoom in. So I can, okay, Nandini, can you read the last question?
Yes, ma'am. The excerpt from the GP newsletter explains that the main aim of the new service is to.
So what do we need to find out here?
The main aim of the new service.
The main aim of the news service. The main aim of the new service is to what? What is it? Okay, what is the main aim of the new service? So we know we are going to read a newsletter for GPs that explains the main aim of the new service. We need to figure out what is the main aim. Okay, all of you go through it. Come on. Go through it. Come on. Okay, let's go through it. This is the final extract. I need your full attention. So, yeah, Nandini, can you read the heading till here for me, please?
Yes, ma'am. New service for asthma patients. A new service for asthma patients in the community has been launched, which is running daily clinics in GP practices across the city. Patients who have recently experienced an exacerbation or who have recently been discharged from the hospital can be referred. The primary objective of the service is to work with patient to avoid the need for an inpatient admission in the event of an exacerbation. A team of specialist asthma nurses leads to clinic as well as conducting face-to-face reviews for patient within 48 hours of referral.
So they are talking about a new service for asthma patients. Okay, so a new service for asthma patients. They've launched a new service in the community, which is running daily clinics. This service run daily clinics in the across the city, across various GP practices across the city. They run daily clinics. That's what the new service is all about. Patients who have recently experienced a worsening or who have recently been discharged from hospital can be referred. So who just got discharged, or the patients who is experiencing an exacerbation or worsening of their problem can be referred here. The primary objective means the main aim of the service is to work with patients to avoid the need for an inpatient admission in the event of an exacerbation. So in case of their condition worsening, they want to avoid the inpatient admission of the patient, and that is the primary objective of this service. And they have a team of specialist asthma nurses who leads the clinic, who is leading the whole thing, as well as they also conduct face-to-face reviews for patients within 48 hours of referral. So once you have referred the patient, within 48 hours they carry out face-to-face reviews. Okay, all right. Now, last paragraph. Go ahead and read the last paragraph as well.
Yes, ma'am. In addition, an advice hotline has been set up with direct access to the specialist nursing team for GPs seeking advice or referral for a patient in the event of an exacerbation. Additional diagnostic and monitoring tools are available, including portable exhaled nitric oxide machines. These can be used to avoid, diagnose, and assess the adequacy of inhaled steroid therapy.
So other than this, they have an advice hotline. That means a quick telephone line where that has been set up to where the people can have direct access to specialist nursing team, and for GPs as well if they want advice or referral in the event of when a patient's condition exacerbates. Additional extra diagnostic and monitoring tools are also available, including portable, movable exhaled nitric oxide machines, which can be used to, all this can be used to help with diagnosis and assess the need for inhaled steroid therapy. All of you go through it. See, we are looking for the main aim. So here it's clearly given. The primary objective is clearly given. Okay, we need to pick the option that matches with this and reject the option that does not match with it. Okay. So there is a new service which runs daily clinic across various GP practices. Patients who have recently experienced exacerbation or who has been discharged can be referred here. The main objective is to avoid inpatient admission in the event of an exacerbation. They have access to a team of specialist nurses are the ones who leads the whole thing. Once there is a referral within 48 hours, they can get a face-to-face review. They have an advice hotline where they get direct access to specialist nurse team. GPs can get advice or referral for a patient in the event of an exacerbation with the help of this hotline. They have additional diagnostic and monitoring tools, including portable exhaled nitric oxide machines, which can help. All these can help with diagnosis, assessment, and assessing whether the patient needs assess the need for inhaled steroid therapy. Okay, all right. So now let's identify the option that matches with this line. Okay, can you read each option with the question for me, please?
Yes, ma'am. The excerpt from the GP newsletter explained that the main aim of the new service is to find new ways of diagnosing and treating asthma.
Is that it? They want to find new ways to diagnose and treat asthma. Is that the main aim?
No.
No, ma'am.
No, the primary objective is that's not it. So that's not the one. Next one.
Question is not visible.
Okay, yeah, now.
The excerpt from the GP newsletter explained that the main aim of the new service is to provide support to all patients with a history of asthma.
Are they providing support to all the patients who have a history of asthma?
No, ma'am.
Is that the main objective? No. So the main objective they've given here. So of course, option C is the answer. Can you read that out loud?
The excerpt from the GP newsletter explained that the main aim of the new service is to reduce the number of asthma patients admitted to hospital.
See, that's exactly what is given here. The primary objective is to avoid the need for an inpatient admission. So that's what admitted to hospital. We got our answer. Okay, so that's what it is. Okay, so this is a very good material. Please go through it, and if you have any questions, get back to me. And remember, tomorrow morning as well as evening, we will be having part C reading. And please make sure to join at least 3 minutes early. Okay, because I think I've changed the invite password, so it's a bit difficult for everyone. So make sure to join at least 3 minutes early so we can start the session. Tomorrow's extract is a bit tricky, so it will take me time to convey things. So make sure if you're planning to join at least 3 or 2 minutes early, make sure to join. Okay, all right. So that's it for today. I'll see you guys tomorrow. Thank you so much.
Thank you.